From Dynamic Piercing, and this is Deb from Dynamic Piercing and Tattoo, and this is a video for your piercing appointment. It's a pre-piercing information video. So I want to go over some of the risks of piercing, etc. So some of the risks of piercing. First one is reaction to jewelry, and that happens a lot. An allergic reaction is basically a chemical reaction between the body and the metal. And we use biocompatible metals such as surgical stainless steel and titanium. They're very biocompatible. However, the body can still have an allergic reaction to those because, again, it's a chemical reaction. And if the chemicals in your body don't mesh with the chemical, even in the biocompatible metal, you'll have a reaction to it. I've known people that can't have piercings because of that, although that's uncommon. It can happen. So reaction to jewelry is one of the risks of piercing, and that is different from infection. A lot of people think that infection and reaction are the same thing. They're definitely not. Infection is caused from bacteria. Reaction is a reaction to the jewelry. So to reduce the risk, we use the biocompatible metal. We are regulated by the health department to do that. And it usually doesn't cause a lot of problems when you do piercings when you're using the correct metals, but it can. Another risk of piercing is bleeding. Piercings typically bleed. Navel piercings, sometimes they do, sometimes they don't, but they can. But bleeding is very normal and nothing to worry about. I have to mention that. I've had a lot of people ask me in the past, is bleeding normal? And it is. It's nothing to worry about. Typically, as long as you don't have any bleeding issues like von Willebrand's or something like this, some kind of anemia, any kind of clotting issues, then bleeding isn't a problem. And most people, will stop bleeding and don't have any other issues as far as that goes. Let's see here. The biggest risk of piercing is always infection. Bacteria is what causes infection, and it's different from having a reaction to the jewelry. Bacteria live on every surface. Your hands are the #1 carrier of bacteria. So the most important thing about infections is to not touch your piercing, and that includes no turning jewelry. I know a lot of people in the past have been told to turn jewelry in their piercings, and that's not good information. When you turn jewelry in a piercing, #1, you increase the risk that it becomes infected. #2, you're disrupting the healing because you're tearing the healing that's taking place inside the wound. A piercing heals from the outside edges moving in toward the center. And when you turn the jewelry, you tear that healing tissue inside, so it disrupts healing. So turning jewelry is a really bad idea. Don't do that. No touching, no turning, and that's the best way to reduce infection. Now, piercings can always get infected during healing because bacteria live on every surface. Some things that people don't think about. Touching is usually the #1 reason they get infected. And you can touch your piercing and not even realize you did. So it's just a really good habit to get into, paying attention and not touching. But dirty bed sheets can lead to infected piercings, dirty pillowcases as far as ear piercings go. Laying on a couch that is contaminated, letting an animal lick the piercings. But #1 is the not touching part. If you were to get an infected piercing, we don't take the jewelry out of infected piercings because then you're trapping that bacteria inside. By leaving the jewelry in, that hole stays open and that infection can drain out. But it's not a good idea to try and clear up infection on your own. It's better to go to the doctor and get an antibiotic. Now, I'm not a doctor, but I tell people that you can always contact me when you're having an issue because I can usually figure out, is this a reaction to jewelry or is this infection? But here's the thing. If it's midnight, you can't reach me, whatever, don't hesitate to go in and seek medical treatment, either at an urgent care, an emergency room, something like that, because you don't want to take any chances. Infections can turn bad really quickly. So never hesitate to seek medical treatment, but you can always contact me, if something initially happens or whatever. So let's see here. As far as aftercare on a piercing, aftercare has nothing to do with keeping the piercing from getting infected. That is not why we clean a piercing. The only reason that we clean a piercing is because a piercing gets crusty around it. The reason it gets crusty is a piercing is a deep puncture wound. It's a tube, okay? And if we don't put a piece of jewelry into the tube, then what happens is the tissues come together, where's like that, like a cut. Get in the camera here. And there we go. Comes together like a cut, and then those tissues knit back together. So, you know, when you cut your arm, you can initially pull that cut apart, right? But when you go to sleep at night or whatever, you wake up the next morning, that cut is closed, it's sealed. And that's what happens with a piercing if you don't put jewelry in. When you do the piercing, the tissues come together, they knit back together. It's called the process of approximation. So we don't want that to happen. So in a piercing, we put a piece of jewelry into the hole to block that from happening. Now the piercing has to heal differently. It's going to heal from the outside edges in. Your body goes through a 3-stage healing process: inflammation, swelling, always the first stage of healing, so that's nothing to worry about. The granulation stage and the maturization stage, and those stages kind of overlap each other, but it takes months for that to happen. So generally, I will tell you to not change jewelry for several months when we do the piercing, because of that reason. If you change the jewelry too soon, you risk two things. Number one, you risk infection because the deep inside tissue is not healed. It's still an open wound. You introduce bacteria, you have an infection. Number two is those tissues close up really quickly. They will just come together really fast, and you risk losing the piercing doing that. So you don't want to change the jewelry too soon. But that's the only reason that we clean a piercing, is because a piercing is a deep puncture wound. And the tissues inside of there, because we have it blocked so it doesn't close, are continually leaking body fluid until they begin to heal. That body fluid has to go somewhere. It rolls outside the wound, the air hits it, and it dries. You get a crusting or a scabbing outside the piercing. Don't turn the jewelry, even if it's stuck, in a certain position, because it's stuck because the body fluid has leaked out of the wound and it dried, attached to the tissue and to the jewelry post, and it causes it to appear stuck. And that doesn't mean that the tissue is adhering to the jewelry post. It's not. That just simply means that you have the crusting that is caused from the body fluid rolling outside the wound. We want to get the crusting off because it blocks air from getting to the wound. Air really helps with healing. So the product that I give you for aftercare is just a sterile saline solution. It's very easy. You missed it on the front and the back. That's an ear. On the nose, it's just going to be on the outside. You don't have to spray the inside. It's moist enough inside the nose. The crusting tends to turn loose on its own. You don't need Q-tips or cotton balls. You're just going to let it dry naturally. That wetness just kind of loosens it, and it flakes off on its own. Very easy. If you forget to use your aftercare product, that is not a big deal at all, because we're not cleaning a piercing to keep it from getting infected. Cleaning has absolutely nothing to do with keeping a piercing from getting infected. Not touching does. So if you forget to use your aftercare, don't worry about it. You haven't lost anything. It's still going to heal. The crusting will still come off on its own. And I would rather you do absolutely no aftercare on a piercing than wrong aftercare on a piercing. So I don't want you using any foreign liquids on it. No peroxides, alcohols, anything with benzalkonium chloride in it, like Bactines. Even that ear care stuff from Claire's has, it's some kind of an acid. It's, I can't remember the name. You can look it up on the internet. But anyway, all that stuff is detrimental to tissue. So I would prefer you don't use it. You don't need it anyway. You don't even have to do aftercare on a piercing, and it's still going to heal as long as you don't touch it. Let's see. So I think that's pretty much everything as far as the information it's just basic information you need for the piercing. And I'll go over some other things when you get here, and we'll look at the jewelry and stuff like that and talk about jewelry types, because we have to use the proper length of jewelry to accommodate swelling, and just jewelry, that's going to help with the healing process, because you can put jewelry types in there that don't go in certain body parts, and it doesn't turn out too good. So anyway, we'll talk about all that when you get here. I hope that helps. If you have questions or concerns about this video, something you don't understand, we can talk about that when you get here, okay? Thank you so much for watching. See you soon.